If you head to the sink immediately after finishing your dinner, you are not cleaning your teeth. You are sanding them down. Tonight, we are going to stop brushing at the wrong time. In this video, we are going to learn the 30-minute rule that saves your enamel. We will explain how acid softens your teeth, why saliva is your best defense, and the simple, relaxing routine you should do before going to learns of blum, going to learns of blum, going to learns of blum, ancest blum, going to lum. Let's settle in and protect your smile. For decades, we have been told a very simple piece of advice: brush your teeth immediately after every meal. This felt like the gold standard of dental hygiene. It was taught in schools and repeated by well-meaning dentists. For a time, it made sense. If you clean the plate right after eating, shouldn't you clean your mouth right after eating too? But the truth, based on modern dental science, is that this common routine is actually the source of slow, steady damage to your precious enamel. For us as we get older, this damage is especially critical. Enamel, that hard white protective layer, does not grow back. Once it is worn thin, the sensitive yellowish layer beneath it, called dentin, begins to show. This can lead to increased sensitivity, discoloration, and a higher risk of decay. Protecting the enamel we have is perhaps the most important thing we can do for our dental health today. So why is brushing immediately after eating so destructive? The secret lies in chemistry, and specifically in the acidic environment that food creates. Think about what happens when you enjoy a meal. Whether it's breakfast, lunch, or a gentle evening meal, most foods contain some level of acid, especially popular items like coffee, citrus fruits, vinegar-based dressings, or anything with sugar. When these foods and drinks touch your teeth, they instantly cause the pH level in your mouth to drop. This is known as an acid attack. When your mouth becomes acidic, the surface of your enamel softens. It's a temporary change, but a crucial one. Imagine a hard, rigid sponge being soaked in water until it becomes soft and pliable. Your enamel reacts the same way to acid. It is temporarily demineralized and vulnerable. If you introduce a toothbrush at that exact moment, even a soft, bristled one, you are effectively scrubbing away the softened, vulnerable outer layer of the enamel. It's like scrubbing a wooden table that has just been soaked in solvent. You aren't just removing debris, you are physically grinding away the structure. This is a subtle injury, one you cannot feel in the moment, but which accumulates over weeks, months, and years. Over time, this immediate brushing routine is responsible for unnecessary wear, especially near the gum line, where the enamel is naturally thinner. This knowledge is not meant to cause anxiety, but to empower you with a small, calming adjustment to your routine. It is a protective measure, designed to preserve the strength and integrity of the teeth you have relied on for so long. Now, you may wonder, if acid softens the teeth, how do they return to their normal hard state? The answer lies in one of the most effective, underrated protectors in your body: your saliva. Saliva is nature's perfect mouthwash. It contains essential minerals like calcium and phosphate. After an acid attack from food, your saliva begins its slow, steady work of neutralizing the acid and washing away food particles. Crucially, it remineralizes the softened enamel surface, essentially hardening it again. It takes time for the saliva to fully complete this restoration work. Studies show this buffering and hardening process takes anywhere from 20 to 40 minutes. This is why this gentle shift in routine is so powerful. By giving your mouth this time to naturally recover, you ensure that when the toothbrush finally touches your teeth, the enamel is hard and resilient again. You remove plaque and debris without causing erosion. This natural buffering process becomes even more vital as we age. Many common medications, such as those for blood pressure or depression, have a side effect of causing dry mouth. If you have less saliva, the neutralization and remineralization process takes even longer. Therefore, the commitment to waiting is an investment in your long-term comfort and dental stability. If you find this gentle, evidence-based health guidance helpful, please consider pressing the like button on this video and subscribing to the channel. Your support helps ensure we can continue to share these slow, helpful reflections designed for your quiet time and better sleep. The solution, therefore, is the asterisk 30-minute rule. After enjoying any meal or drinking anything other than plain water, you must allow at least 30 minutes to pass before brushing. This gives your saliva the crucial time it needs to neutralize the acid and allow the enamel to harden again. This 30-minute window should not be a rushed or anxious time. Instead, we can redefine it as a quiet transition period. After dinner, perhaps this is the time you step away from the table, read a few pages of a book, or simply settle into your favorite chair. It is a pause, a moment of digestive rest and silent care for your teeth. Make this waiting period a gentle ritual, not a chore. But what should you do during those 30 minutes? We don't want lingering food particles sitting around. The key step during the waiting time is a simple, peaceful, plain water rinse. Immediately after eating, take a sip of plain water. Swish it gently around your mouth for about 10 seconds, and swallow or spit it out. Do this 2 or 3 times. This simple action immediately helps to wash away large food debris and slightly speeds up the neutralization of the acids left behind. Water is pH neutral and is your most trusted dental ally. If you have a very dry mouth due to medication, or if you consume something particularly acidic, you may gently chew sugar-free gum containing xylitol. This helps stimulate saliva production, significantly boosting the natural protection process. This is not about fighting the acid fiercely. It is about gently supporting your body's natural rhythm. Let's talk specifically about the morning routine, as this is often the trickiest time. Many people enjoy a slow morning coffee or tea followed by toast or fruit. If you immediately brush after your acidic coffee, you are causing friction damage to the softened enamel. There are 2 effective strategies for the morning. Strategy 1 is to brush before time breakfast. Brushing before you eat cleans the surfaces of bacteria and plaque, which helps your saliva work more efficiently during the meal. Then, after breakfast, perform your gentle water rinse and wait the 30 minutes. Strategy 2 is for those who prefer to wait entirely. If you wait until 30 minutes past your last sip of coffee, remember to keep your mouth hydrated during that window. If you are a slow, hours-long sipper of coffee, which is a very common habit, you should try to condense the drinking time. The constant, infrequent sips mean your mouth is under constant acid attack for hours on end, never getting a chance to recover. If you must have a lingering drink, follow each sip with a small sip of plain water. This dilutes the acid and is a quiet act of kindness to your teeth. You might be thinking, this sounds complicated. Do I need to set a timer? Absolutely not. The spirit of this channel is safety and slowness, not stress. We are aiming for a general, gentle rhythm. If you wait 25 minutes, that is excellent. If you wait 40, that is even better. The goal is simply to stop the immediate habit and introduce that crucial, restful buffer. Another common question that arises is related to using an electric toothbrush. Does the 30-minute rule still apply if I use a sensitive electric brush? Yes, it does. While electric toothbrushes are incredibly effective at removing plaque, the mechanical friction remains, and the damage caused by brushing softened enamel is still a factor, regardless of the device you use. The rule is based on the chemistry of your enamel, not the tool you use to clean it. What about those of us with dentures or partials? If you wear a full set of dentures, this rule is less critical for the denture material itself, which is not affected by acid in the same way. However, if you wear partial dentures, you must absolutely prioritize protecting the remaining natural teeth that hold the partial in place. These support teeth are often the most vulnerable to decay and erosion. Treating them with the same respect and waiting period is paramount for the stability and fit of your partials. If you remove your partials after a meal, a gentle rinse of the mouth is still highly recommended before you settle in. Let's address the quiet issue of nighttime reflux. Some seniors experience acid reflux, where stomach acid creeps up into the throat and mouth, particularly when lying down. This is an internal source of powerful acid attack. If you suffer from reflux, waiting 30 minutes after your last meal is essential. Furthermore, never snack immediately before lying down, and if recommended by your doctor, raising the head of your bed may help. This combination of strategies ensures your mouth is protected from acid both from food and from the stomach before you fall asleep. The greatest wisdom in health routines is often found in the quiet moments of patience and protective self-care. It's not about how hard you scrub, but how softly and intentionally you care for yourself. Tonight, as you prepare for rest, remember the difference between cleaning and protecting. Brushing is cleaning. Waiting is protecting. You have already taken the most important step by simply listening to this knowledge. Now, the next time you finish your evening meal, allow yourself that 30 minutes of quiet time. Step away from the kitchen. Take a slow, deep breath. Gently swish with water. Let your saliva do its slow, perfect work. This small, unhurried change is a powerful act of preservation. Before we drift off, I encourage you to subscribe to Senior Bedtime Radio. By subscribing, you ensure these gentle, protective health tips and soothing reflections always find their way to you, helping you maintain a rhythm of peace and dignity. We have covered why we stop immediate brushing, the gentle power of saliva, and the simple 30-minute wait that safeguards your smile. Remember that taking time to care for your teeth is taking time to care for your whole self. Rest well, knowing you have protected your smile for another day. Drift off now, safe and unhurried.